Kick-ass facts! Pew, pew, pew! More medical anomalies. Alice in Wonderland syndrome, or AIWS, is a neurological disorder where perception gets totally warped. People with AIWS experience bizarre distortions in how they see their own body or the world around them. For example, their hands may look gigantic or tiny, and rooms may appear to shrink or expand. Distances or time can feel oddly altered. These episodes can last from a few minutes to a few days. The syndrome is usually linked to migraines, epilepsy, or infections, or even certain medications. Hypertrichosis, sometimes called werewolf syndrome, is an extremely rare genetic condition where hair follicles cover large areas of the body with thick, excessive hair growth. Some cases involve nearly the whole body, including the face, palms, and soles of the feet, which normally don't grow hair. It's caused by gene mutations or abnormalities in hair growth cycles. Aside from the social and psychological challenges, the physical effects can include skin infections due to excessive hair. Walking corpse syndrome, or Cotard's delusion, is a psychiatric disorder where people believe they are dead, don't exist, or have lost their internal organs. They may refuse to eat or drink because in their mind they're already lifeless. It's extremely rare and typically linked to severe depression, psychosis, or brain injury. A man's heart became so calcified that it essentially turned into stone, severely limiting its ability to pump blood. This condition is known as porcelain heart or cardiac calcification, and it can result from chronic kidney disease, infections, or metabolic disorders. The buildup of calcium deposits stiffen the heart walls, leading to heart failure. In some cases, surgeons have attempted risky operations to replace or bypass the calcified valves. In a rare medical condition called cutaneous respiration, a woman was able to absorb oxygen through her skin. While we normally rely on our lungs, in some rare diseases or injuries where lung function is impaired, the skin can compensate slightly if kept moist and healthy. The phenomenon is more common in amphibians, but very rarely documented in humans, and usually a last-ditch adaptation. Exploding head syndrome is a sleep disorder where people hear loud, sudden noises like explosions, gunshots, or cymbals crashing inside their head just as they're falling asleep or waking up. It is harmless but terrifying and can cause anxiety and insomnia. The exact cause is unknown, but might be linked to minor brain or ear dysfunctions. Ulnar demelia, also called mirror hand syndrome, is an ultra-rare congenital anomaly that causes a person to be born with a hand that has duplicated fingers arranged like a mirror image. So instead of a thumb on one side and a pinky on the other, they may have two thumbs or two pinkies mirrored across the hand. It's caused by abnormal limb development in the womb, and function can be surprisingly good, I would imagine, and surgery may be done to improve usability. Hyperdontia is a rare dental condition where a person develops extra teeth beyond their usual number. These supernumerary teeth can appear anywhere in the mouth, often near the front, upper teeth, or behind the molars, and may be fully formed or oddly shaped. Sometimes they remain hidden under the gums, causing crowding, misalignment, or blocking the eruption of normal teeth. While the exact cause isn't fully known, genetics and certain conditions can play a role. Treatment typically involves surgical removal of the extra teeth, followed by orthodontic care to correct any resulting dental issues. A live ladybug was found in a man's transverse colon during a routine colonoscopy. It was documented in 2019. The patient, a 59-year-old man, was undergoing a screening colonoscopy when the medical team observed a live ladybug crawling around inside his colon. He had no recollection of swallowing the insect, and the exact manner in which it entered his digestive tract remains a bit of a mystery. However, it's been speculated that the extensive bowel preparation, which include consuming a gallon of polyethylene glycol the evening before the procedure, might have allowed the ladybug to survive the digestive process and remain in the colon intact. A young man visited the doctor because he'd been slowly growing a mass on his right eye ever since childhood. On examination, there was a raised yellowish-white lesion with two small hairs sticking out. The mass was removed with a procedure called lamellar keratectomy, and testing confirmed it was a limbal dermoid, a benign growth made of normal but misplaced tissue that can sometimes contain things like hair, teeth, or bone. A 61-year-old male told his doctor about discomfort in his mouth, which had been present for 6 months. He had a history of diagnosed and treated cancer of the buccal mucosa, which is the inner lining of the cheeks inside your mouth. He had been treated with radiation therapy, and doctors removed the affected area and then replaced it using tissue from his forearm. During the exam, the doctors noted several hair strands that were actually growing from the inside of the patient's left cheek and extending toward the roof of his mouth. The donor skin had hair follicles, and the hairs continued to grow in their new location. Jugular vein distension, JVD, is when the big veins in your neck become swollen and stick out. It usually means there's too much pressure on the right side of the heart. One serious example is cardiac tamponade, maybe, a life-threatening condition where the fluid builds up around the heart, squeezing it so it can't fill properly. This causes the blood to back up, making the neck vein bulge dramatically. This is someone with JVD so severe it looks like the neck vein is about to burst. She needed emergency treatment to drain the fluid and save her life. Triphalangeal thumb is a rare genetic anomaly where the thumb has 3 phalanges or bones instead of the usual 2. This extra bone makes the thumb longer and sometimes more finger-like, which can affect how the thumb moves and functions. People with triphalangeal thumbs might have trouble gripping or pinching. Great hitchhikers, though, and in some cases it doesn't cause major issues. The condition can occur on its own or part of a genetic syndrome. Surgery is an option if the extra bone interferes with hand function. Not a medical condition, but something to be aware of, certain Lululemon leggings and similar athletic wear that contains metallic fibers, such as silver-infused threads designed for odor control and stretch, these metallic components can pose a serious risk during an MRI because the strong magnetic fields can cause the fibers to heat up, potentially resulting in painful skin burns. Although newer Lululemon products reportedly don't use these fabrics, older items may still contain them.